Okay, great. First of all, I would like to introduce myself. For those of you I have not met yet, my name is Doug Sommerville. I'm the CEO for QuestCap. And joining me today on the webinar is Mr. Tim Shelburn. Tim is the president of our Collection Sites LLC. And much of what we're going to talk about today will be focused on the operations of our collection site subsidiary, wholly owned subsidiary. Before we get going, I would ask Aaron Ayton to start by reading the disclaimer. Aaron?
Thanks, Doug. The purpose of this call is to provide investors with an update on QuestCap's business developments with a primary focus on its subsidiary, as Doug mentioned, collection sites. During this call, QuestCap may make statements that contain forward-looking information within the meaning of applicable Canadian securities legislation. Forward-looking information will include, but is not limited to, statements with respect to the results of collection sites cubes, the proposed rollout of additional testing sites, the pursuit by QuestCap of investment opportunities, and the merits of potential returns of any such investments. Forward-looking information is subject to known and unknown risks, uncertainties, and other factors that may cause actual results to be materially different from the conclusions, forecasts, or projections expressed or implied by such forward-looking information. Certain material factors and assumptions have been applied in drawing the conclusions or making forecasts or projections reflected in the forward-looking information. A description of the factors that could affect and the assumptions underlying forward-looking information can be found in QuestCap's annual information form, financial statements, and accompanying management discussion and analysis, as well as public disclosure documents that are available for your review under QuestCap's profile on SEDAR. Participants should not place undue reliance on forward-looking information. QuestCap does not undertake to update any forward-looking information except in accordance with applicable securities laws. Thank you. Back to you, Doug.
Thank you very much, Aaron. Again, welcome everyone to the webinar this afternoon. I would like to tell you that we're extremely excited about what we're going to be able to share today. I will do an initial introduction and a little bit of a high level on some of the reason for that excitement, and then I'll turn it over to Tim Shelburn, our president of Collection Sites, to tell you a little bit about the model itself and the success we've been experiencing. What I will do is I will attempt to share my screen with everyone so that you get a chance to see the presentation itself. So Collection Sites, as many of you are aware, is our solution for the ultra high demand of COVID testing in the marketplace. A little bit about what we're seeing. That demand has and continues to be insatiable. The US Department of Health and Human Services plans for 105 million tests that were to be taken between September and December of this year. The Rockefeller Foundation came out with a report recently that indicated that the current 5 to 6 million tests per week that were being done should ramp up to something closer to 30 million during the fall and the winter season, when we have a cold and the flu virus is also impacting, and really having to understand whether it's COVID, whether it's cold, whether it's flu. They recommended rapid antigen tests, and we'll talk a little bit about the rapid antigens as part of our program. There's a huge market for testing. It continues to be a growing market. You see certainly some peaks and valleys at certain times of the year, but it continues to be very, very steady. And we'll show you a little bit more about that in a minute. We also expect, and experts estimate, that the level of testing will not fall away anytime soon. There's very, very strong anticipation that we will be testing throughout 2021 and well into 2022. It may shift over as vaccines take place to more antibody testings as people begin to see what the impact is on the antibodies that are formed through the inoculation of the vaccine. We've also seen that the testing for COVID has remained very strong. There is a very large part of testing between $100 and $149 in the marketplace, some as high as $300 plus. And we expect that the median pricing for the 127, we haven't seen a fall off in that. And more than 1 in 5 tests are more than $200. We see that quite commonly in the US. We also have began a very large national rollout, and Tim will talk in more detail about where that rollout is and the progress we're making in that rollout. But it is national, and it is with a number of partners that we have contracted with across shopping centers and various types of locations that provide easy access, convenient access to patients who require testing. This is the demonstrated performance that we have seen, and I can tell you it is extremely exciting what we've been able to see in the performance. Just prior to Thanksgiving, we saw a very large run of testing, a demand for testing. We reached 91 tests per cube as of November 25th. We also have seen that continue fairly strong throughout the post-Thanksgiving period. And we're also now seeing spikes in cases. For many of you, if you're familiar with the Canadian market, Thanksgiving in Canada was a super spreader event. And there was a lot of anticipation now being played out that the Thanksgiving in the US had a similar type of impact. And you're seeing cases rise rather significantly. We have multiple sites right now doing over 100 tests per day. And we had one do as many as 186 tests in a single day. Our average testing price is coming in around $90. Our break even is 5 tests per day. If a cube does 5 tests a day at the $90, we have a break even for that cube. Our highest demand test is the antigen test. That is a test that will give a rapid result. It's a result that they can initially get at the cube and then get a document to follow up, giving them a positive or negative for detection of the virus. And the marketing spend per cube at this point in time is as little as $500 per day for all 20 cubes that are currently in operation. We've also seen a very nice growth in our cumulative revenues and our weekly revenues. As we begin to place more cubes, and Tim will go into more detail on the cube placement, we have 20 operating as of this week. We have 25 more that are starting operation next week. The goal being to have 100 by the end of the year and 225 by the last week of January, or the middle of January, at a conservative 60 tests per day, which we are seeing easily generated at many of the cubes. That represents $162,000 in monthly revenue per cube. If you take the look at the number of cubes and you then take a look at the revenue we generate, the number of tests we can do per day, you can see that the math accumulates very, very quickly. We have a substantial upside per cube. We have seen cubes do as many as 150 plus tests a day, that one doing 186. We're open for a maximum of 10 hours. We can do 15 maximum per hour, and we're open for 10 hours a day. If a site does 150 tests over that 10-hour period at 15 an hour, they generate $405,000 in revenue, and with an EBITDA of margins over 55%. And we have 740 plus sites under contract right now that we're beginning to place cubes. Tim, why don't I go ahead and give you can take them in a little more detail about what we're doing in our overall collection sites model. Tim?
It looks like Tim's screen may be frozen, Doug, so you might have to just keep walking through here.
I'll keep walking through. As we've talked about in the past, these are mobile pop-up cubes. It's an 8 to 10 minute test that people take for the PCR for an antigen and an antibody. The rapid antigen test, they're able to get results while they are at the actual collection site. For the PCR and the antibody, they get the result the next day. And that is submitted to them via email or by a text in our application that we have with our laboratory partner. We have, as I mentioned, over 740 locations, and we've demonstrated over 150 tests per site at $90 per test. And you see in the right side of the screen, you see the 8x20 pop-up collection site that we're using currently. We started with a 10 by 10 cube. The first 20 were those 10 by 10s. We now have a supplier who can allow us to have an indoor type testing facility for some of the inclement weather in the Northwest and Northeast, et cetera. And the cubes in California are the ones right now are the pop-up window testing facilities. There's a look at the one that's currently in use, the 10 by 10. It's depending on the size, it's between 100 and 200 square footprint. We have a weekly rental payment for the space, and we also have all of our testing is done through our partner, our CLIA certified lab partner, Alcala. And you have the ability as a patient coming to get tested, you have the ability to offer more than 60 or be offered more than 60 insurance coverage plans. Those are all on the website. When you sign up, you determine the insurance that you're using to cover at least a copay portion of your particular testing revenue. And everything's done on our website, which is the www.testbeforeyougo.com. And the same day results are via text or email. The PCRs would be next day, and it's a 98% accuracy on the testing results that we provide. We also have a very unique opportunity in California. We have received a waiver, and we're the only lab with state approval for pop-up locations in California. The Health and Human Services, as we mentioned, has talked about the need for significant numbers of testing this fall and winter. And California, where we have this unique opportunity, accounts for 15 million of the planned tests of the nationwide tests that are going to need to take place. Our nationwide footprint is working with our various partners. We've contracted 743 plus locations in the US. We have the Simon Group, Brixmor, Sandor, Brookfield Malls, all of them being large shopping retailers, either large fashion mall type of providers like Simon. In the case of Sandor, they are more big box places like Target, Walmart, etc. Are leased through their operation. And then we have others that we have on contract. H&S is a convenience store gas operation that operates in California. And one soon to be announced. That brings us to the 743 that we have currently under contract. At each of the centers, we offer 3 tests. The tests are a rapid antibody test. The antibody test basically indicates if a patient has been infected in the past and whether or not they've developed any of the antibodies in their immune system to fight off the virus. This is going to be an extremely important test as we move towards vaccines. And if Tim comes on, if Tim can come back on, we can ask him about our plans for how we're going to participate in the vaccine distribution model as well. The other test is the RT-PCR test. That is the test that many of us are familiar with, where you see the nasal swab. It is taken into a sample. The sample is sent to a laboratory, and the laboratory results are sent back typically next day to the patient. And that is done through mainly a nasal swab. And a positive result is a detection of whether or not you are actually carrying the virus currently. It will not tell you whether or not you have been exposed to the virus in the past. That's the antibody that will do that. The one that we are seeing the most demand for is the rapid antigen test. The rapid antigen test is a nasal swab that is placed on a cassette type of operation. And the result is a positive or negative in basically about 10 minutes. It will give you that positive or negative. The rapid antigen is a very unique test. There's only 2 currently with EUA that do not require instrumentation. We have access to one of the 2. The other was the Abbott test that President Trump bought very large inventories of. So we're fortunate to have accessibility to antigen testing. Right now, when you look at our mix, the antigen tests, which we sell for $99, we do about 60% of all of our testing as antigen tests. The antibody test, which is sold for $59, we do about 25%. And the PCR test, which is sold for $179, we do about 15%. That's the current weighting between the 3 different types of tests. We have a operation that guarantees right now we're looking at a 98% agreement of positive and negative results based on the EUA approved tests that we have in place currently. The results can be as early as 10 minutes with the rapid antigen and certified lab results next day for the PCR. We also, everything we do is certified and verified through our CLIA certified lab partner, Alcala Labs. And all of the confirmations are sent by email or text through a HIPAA compliant patented software program, and the patient receives those results as soon as those results become available. Our advisors are 2 extremely professional, very, very experienced advisors. Dr. Glenn Copeland, originally specializing in sports medicine, was brought in very, very early in the pandemic to work with many of the sports teams across North America to develop ways that they could bring sports back. He was in many of the discussions with the NBA, the NHL, and participated in the forming of the bubbles, et cetera, that were very successful in bringing those sports back to North America. And we also utilize the services of Dr. Lawrence Steinman. Dr. Steinman is at Stanford. He is the professor of neurology, neurological sciences, and pediatrics, and was chair of the immunology program at Stanford for 10 years back in the earlier 2000s. And he focuses on antigen-specific tolerance in autoimmune disease and is extremely knowledgeable and a go-to person for us when it comes to looking at the various types of technologies that we have available. And with that, I'm going to stop sharing my screen. And Tim, have we got you back yet?
It doesn't appear like he's been able to get connected here.
Okay, great. So a couple of questions, Evan, if you want, I will address a couple of questions that have come in.
Yeah, absolutely. And I think touching on the vaccine side of things as well is another one that came up before.
Okay, sure. So first of all, the question has come in, are the tests approved by the FDA? Every one of the tests that we're using is EUA certified or registered. The FDA, under the emergency use authorization, which is the program that they put in place for COVID, we are using tests that fall under those categories. So they have all been reviewed and they have all been authorized by the FDA. Other question we have is, are there enough tests to meet anticipated output? And if not, are there plans to partner with additional test providers? Great question. The answer is yes. Right now, on the first part, we have enough tests to meet the anticipated output, but we are, of course, for future plans, making sure that we're on top of any of the potential provider partners that we can work with. We're in conversations regularly with a number of potential individuals that can supply us testing that meets all of the necessary regulatory approval. Other questions that have come in previously, Evan, that I can address?
No, the questions I think were mostly covered. I know there's a lot of questions about the timelines on the rollout, but I think you provided good color there. And then there's always questions around just the opportunity and what we're trying to do on the vaccine side of things.
One of the things we are looking at is how to utilize this network of centers that we'll have across North America. Well, across the USA. We're looking at opportunities outside the USA, but we certainly are focused on the United States, and how we could potentially be a part of vaccine distribution, not only on the distribution side, but potentially also on the inoculation side. We are in discussions with a number of government level, very senior government level individuals on how by placing the appropriate staff that we could provide inoculations to patients who require the vaccine. So that is certainly a model that we're excited about. We have some conversations in place, and we're hoping that we'll be able to get a green light to participate. It's a natural fit in my mind that we would be able to move over to vaccines because we would have that capability through all of the sites that we will have established, but also we have the network of staffing agencies that can provide us with the appropriate personnel who would be registered and authorized to be able to give inoculations. So all of that is something we're excited about. We don't see, however, that's something that's going to be needed in the immediate future because we believe testing for at least well into 2021 is going to become an absolutely critical component of fighting this virus. If anyone saw the article in the New York Times this morning, there's a very good article about the need for testing and how it is a proven fact that testing and isolating is the best way to fight this virus. And the complaint was that they can't get enough access to the rapid antigen tests. And that is what we're promoting. And we're actually going to be contacting the individuals to make sure that the individual wrote the story to make sure that they are aware that of our expansion into offering rapid antigen. He had taken one himself at a pharmacy operation. He was able to get it, the only one he could find in the area. And his complaint was there wasn't enough of it. So it just shows that that demand is going to continue and continue very strong. There was a question on any updates from South America, Colombia distribution sales. We actually have we're waiting for the final or for the most up-to-date results. They are very actively expanding their program through Sanity, where we have a 28% interest in Sanity in South America. They are offering a testing program in Colombia, and that testing program is growing, and they're expanding to another location in Bogota, and will be expanding into many of those operations to get access to testing for the Colombian population. We have a question on where do we see the share price going towards the end of the year. I'm excited. I think it's going nowhere but up. I don't want to speculate on how high I think that will be, but the revenue we're now seeing generated, the EBITDA that we're able to realize from collection sites is the most exciting thing that we've seen in a little while, as we've been working through a strategy to have both some longer term research type operation that we're working with, but a much more close term revenue generation like collection sites. And that right now is taking a lot of our focus and making sure we get that up, successfully operating, expand as fast as possible, and take advantage of that situation. Somebody asked, I might have missed them, but how many cubes are out so far? We have 20 currently in place right now. We have 25 more that are on the ground. Most are on the ground. There's a couple more to be delivered, and they will be operating next week. We want to be at 100, and we have plans to be at 100 by the end of the year. We then want to be at 225 by the end of January. And they asked by the end of March. By the end of March, we'd like to be as close to our leasehold commitment as we possibly can be. So we'd like to see it in the hundreds. And we have that capability with our mobile office partners we're working with. And it's just a matter of us properly rolling it out. And we've gotten excellent experience with the first 20, and we're now seeing it expedite quickly for moving forward. Update on Toronto Hospital's investment. We are continuing to work with both. They are both continuing their research. We are talking to them at what stage they're at. We want to make sure that the investments are being well spent. So those conversations are continuing. There is nothing specific that I would say is able to come to a commercial realization at this point in time, but that is not surprising. It's what we had potentially anticipated. We've received a question of what is the business activity after 2021? Is Corona not a main issue anymore? Testing will be something that we are looking at. We're actually currently looking at influenza and a number of other in vitro diagnostic testing capabilities that we believe testing is something that people are getting very used to. They will continue to do testing, and there's many different testing that we can do. So we're gonna continue focused on that, and hopefully be very successful throughout 2021, focused on the coronavirus, but beyond that, the vaccine, and beyond that on testing in general for many different formats. How long do you need to build 700 test stations? We're no longer building the test stations. The first 20 we did have purpose built for us. We are now, and if you saw in the presentation, the picture of the 8x20 is a mobile office facility that's available to us. They have those across the nation in 120 different depots. Our partner is a company called Will Scott, and we're working with them to have those dropped in the locations. And as I say, in 120 depots, they have a depot virtually within a short place of where we need those different sites to be. It allows us to rent them. It allows us on a short-term rental to be able to move them if we need to, and to be able to leave a rental if we need to, if the testing starts to diminish at a certain area. There's a question about FDA approval, and are you acting under some emergency act? Everyone right now is working under the EUA. There is no anticipation that the EUAs will be removed anytime soon. The companies we are dealing with, the testing companies, are also looking at going from the EUA to get 510K for the various types of tests. Most of them are experienced. They've done that sort of work for things like influenza and many other tests that they have in their arsenal and in their portfolio. So most of the companies are moving in that direction, and we'll be working with the companies that even after a EUA, which I don't see happening anytime soon, but even after EUA is removed, there will be a period of time where people will be given a chance to go to full FDA approval, and the companies we're dealing with are all working on that right now because they anticipate that will be something that happens, maybe a year or 2 years down the road. We've had a question about sports team interest. The first sports team that we did and we announced was our relationship with the Houston Rockets. I can't give you specifics, but there are other sports operations that are both working with, looking at the Rockets example, but we are talking to a number of other sports organizations about the potential for providing testing, not only to bring the players back for training purposes, but potentially to bring fans back into the stadium. And certainly our belief is a rapid antigen testing model is something that could be very valuable when you go to try to bring back fans into a stadium. There's a question about Glencoe and some of our other providers. Glencoe has been a phenomenally important acquisition for us for what we've been able to pull out of them in terms of their protocols, in terms of what they had developed on first the sporting side, but well beyond that into many different areas. We've been working with a number of different industries. We hopefully will announce something in the very near future of a very important industry that we've been doing some work with. And those have come through the protocol work that we've been doing with Glencoe. And then the final question I've got, and then we probably, Evan, you can tell me timing wise, but is there any permit issues with other states? There are 1 or 2 states where you do have to go through some special permitting. So that's what we are working with right now. New York and New Jersey are the 2 states that have some potential permitting work that you need to do beyond the licenses that currently exist. So that is what we are working on right now. We certainly have enough sites outside of that to not hold us back in terms of our need to locate sites. So we're working through all of the different states that are available. And most states are. Most states were able to immediately put in sites and have them operate. And we can have units dropped within 2 to 3 days of us actually assigning it to a site and be up and operating virtually the day after that. So these are things that we can do very quickly, and we now have the right partners in place to be able to give us a national scope, and we can drop these sites as quick as we can get them ordered and up and operating. And I think, Evan, that's all the questions that I see currently. Is there anything else that's come in on your side?
Nope, those are all the questions. We're at about 1:30, so we're about half an hour. So I think it's probably great to wrap it up.
Okay, first of all, again, let me thank everyone for participating. I can tell you we are very excited about collection sites. We're very excited about a number of things we're operating in, and some of those will be announced hopefully in the very near future beyond collection sites. But collection sites is something we did want to share the good news of what we've seen with a phenomenally successful business model. One of the things that we are finding and we are learning is you see some of the cubes when they first get announced, as soon as we can get a Google search approval, and Google does certainly investigate before they approve, we see demand go up significantly. We have had pretty significant lineups at the cubes to the point where we have had to look at security. Mall security has been involved with us, working with us to make sure that things are all properly handled. But it's a good news story in the sense that the demand is, as I mentioned earlier, insatiable, and we don't see it ending anytime soon. And we believe we're in the absolute sweet spot to make that happen conveniently and give access to patients. A 10-hour day of operation allows them to come before work and after work. And that is something that many of the test sites don't allow them currently. So we're fitting a very nice gap in the marketplace, and it's a gap that we are being able to see recognized by the revenues we're generating. So thank you, everyone, and appreciate your time. And we'll continue to update you as we get more information on collection sites and all the other things we're doing at QuestCap. You will also note that we will no longer be using QuestCap as of the next few days. We've renamed the company MedEvolve, and MedEvolve will be the name of the company as a sole purpose medical technology company going forward. We're excited about it. It's where we've seen a lot of our success. It's where many of us have our backgrounds, and we're excited about being able to expand in those areas and develop a very, very successful medical technology company. Thanks, everyone. And when we talk to you next time, we'll be talking to you as MedEvolve. Appreciate it. Bye-bye.